any first thoughts with that greeting when they come in the door?
Of course, the greeting's important.
Yeah.
I think it would be nice if you knew who was coming. Like if you know on your schedule you've got 3 patients coming and there's, you know, Joe Jones, Dan Smith, and Betty Sue, and a woman walks in, I mean, chances are that's Betty Sue.
Yeah.
And so if you've paid attention, that's always nice. Oh, Miss Sue, welcome in today. That makes all the difference. Again, what Bethany's saying about the name, knowing the name. But it's hard to remember everybody's name and um, address the patient that way. And watch me, say the guy walks in and I'm like, hey, Joe. And he's like, I'm not Joe. Like, we've been to avoid those situations too, right? So I think just a greeting, eye contact, there should be a greeting, hello, even if you're on the phone, just, right? Like some connection. If you are the only one at the front, that's what you're having to do. If if you've got a teammate sitting there with you, teammate, please pay attention. Please pay attention and be like, hey, she'll be right with you. Or you swoop in and go and help if you can. But I think that is another, if you botch that, you're setting up the rest of the appointment to be very stressful for the entire team. You as well, because they're going to check out and walk by you when they leave, but also for the back team, that's just made the job a lot harder if we don't set the tone right from the minute they walk in the door.
Absolutely. And again, this is where business team, clinical team, if you're stepping up to help, you guys are teeing it up for whether you're going to have a good appointment in the back or a poor appointment. So again, we kind of look at this being first impressions, and we want to set the stage from the get-go and avoid anything that could be even mildly annoying. And I don't know about you guys, but I absolutely hate walking into a place where I'm not greeted. And then I'm standing at the counter. I'm like, should I stand? Should I sit? Is there something? Remember the old school sign-ins? Should I sign in somewhere? It's just the most awkward feeling. And so I agree with Dr. Kubit. We've got to at least, even if we're on the phone, the second we see that door open or hear the door open, I love door chimes, which I know if we've got a security system, that's usually possible to have some type of door chime where we're encouraged to like look up when that door goes off. If nothing else, make eye contact with the patient and motion to them that we see them, like, hi, just for a minute. That is so critical. If we're not on the phone, we should absolutely be greeting them immediately. Don't wait. I was working with an office where they had 3 receptionists across the front, and then the doors probably 10 feet away. It's pretty close. And a patient would walk in and they would wait until the patient walked up to the desk to greet them. And it was this awkward walk. I couldn't put my finger on why it was so awkward, but I think the patient is trying to decide there's 3 people. Who do I go to? Where do I walk up to? And they're not bringing their eyes up until somebody walks up to them. So it was like this weird little dance of like, do I just pick somebody or do I wait for them to greet me? Some patients, I would watch them and the door would close behind them and they would wait for somebody to look up and greet them. And it sounds so small. You're like, is that really a big deal? Yes. Yes, it is. Because it creates an immediate awkward feeling like, do they want me here? Do they see me? Should I say something? And that level of discomfort is not what we want our patients to experience within seconds of walking into our door.
Well, for me, I would feel dumb. I would feel dumb walking in and nobody's looking at me. So first of all, I would be like, am I even in the right building? And then I walk in and then I'm kind of looking up, when you do at like, is this the front of the Chipotle line, like order here, or do I pay here? Like, where am I going? Who am I going to? So already within like 5 seconds, I'm already doubting what I'm doing. The dental office is not the place. You already have so much doubt, anxiety. Am I in the right place already? At least at Chipotle, you're going to get good food at the end of it if you just figure out what side of the line you want to go on, right? But you're walking in there happy. You're not walking in. Most people are not walking into our offices happy.
No.
And so you've just made the patient feel kind of dumb, where they're most likely going to feel dumb at some point during that appointment. And nobody likes to feel dumb. So that little detail matters. Even the inflection, like we were talking about inflection on the phone, that is so important. So if you don't know who the patient is that's coming in and you're like, there's no way, or I can't pronounce that name, or et cetera, right? that's one for me where if you're like, hey, who are we checking in today?
Mhm.
Versus who we're checking in today.
Yeah.
Right. Like just that little bit of kind of rush and personal really is very off putting to me. If somebody does that to me when I walk in, I kind of pause and I just glare at them. So I'm like, what are you doing? Why are you acting like I'm a nuisance? Am I a nuisance here? Because I'm about to pay you a lot of money.
Mhm.
So it's just rude. So I would say that is super important. The immediate welcoming eye contact inflection.
Yes, all of those things. And I think that eye contact is critical as well. I walked into an office recently and the way that I entered was kind of off to the side. So the desk is kind of in the middle and I'm entering on the side of the building. And so I walked in and I can clearly see that there's a front desk, but there's this huge computer screen. And so I was like, I literally couldn't see anybody behind the computer screen. So it was kind of that weird moment where I'm like, okay, I'm just going to walk up to the desk and see if there's somebody there. Sure enough, I walk up to the desk and kind of move to the side of the computer screen. And lo and behold, there's a lady there. And I was like, oh, hi, and so, but that immediate eye contact wasn't there. I'm like, they need to change that setup because she either needs to shift her screen over so that she has direct eye line to that door so that when somebody walks in, she looks up and kind of at least acknowledges with eye contact. But there was nothing, and I didn't even know that somebody was there until I came around and like peeked around, and then she was there. So pay attention to sight lines in your area and make sure that whoever is going to be greeting the patients has the ability to see that door and immediately pop those eyes up and establish eye contact. That eye contact alone will direct the patient, invite the patient to come in.